conference as it moved from an in-person to a virtual platform. We're very, very thankful for that. So obviously your time is very precious. I'm going to just say a few words about Rick. Hopefully he won't be too embarrassed, but just to give everybody a little, a bit of a deeper flavour, because I'm sure you're very well known, but we have some other students and that on the call, so maybe it might be interesting for them. So Rick is a professor at the George Washington University School of Nursing. Prior to that at GW in 2018, Rick served as Director, Division of Practice Environment, and the Senior Advisor for Nursing at the Agency for Healthcare Research and Quality. Rick's research focused on ambulatory care practice improvements in the area of team-based care, outcome measurements, treatment of acute and chronic pain, and improving patient safety practices. Rick served on an active duty in the Army for over 30 years and has numerous positions as pediatric and family nurse practitioner, clinical scientist, and a senior leader. In his last two positions on active duty, he served as Chief of Nursing Research at Walt Reed Army Medical Center and Director of Research at the Defense Centers of Excellence for Psychology or Psychological Health and Traumatic Brain Injury. In addition to having experiences in the clinical, research and educational, as well as health policy areas, Rick brings corporate governance expertise to the position, has served on many of the board positions of Sigma, and obviously at community and national level boards of non-profiting corporations and associations. Just to give everybody a bit of an example, he served as President of the National Association of Pediatric Nurse Practitioners, President of the NAPA Foundation, Chair of the Sigma Building Corporation, and Treasurer and Vice President of Sigma. Rick remains a part-time nurse practitioner at Walt Reed National Medical Center, and today he will obviously give his keynote, and I mentioned the title of it at the beginning, but just to refresh ourselves, it will be Influencing Global Health, Reflections on the Past and Plans for the Future. And my question, Rick, is questions and answers will we have when you have finished your keynote? Will that be
yes.
Okay?
Yes, of course. I love questions, and I like the tough questions. So please don't be shy in your questions, your thoughts, your comments. Love to hear anything and everything from the field. Thank you so very much, Marie-Louise, for that introduction and for the invitation. And of course, thank you very much to Lourdes Lumba, Professor Lumba, for the invitation, for being the president of the chapter, and for your willingness to host this conference. Also, I would like to put out a big thank you to all the individuals who have been integral in moving this conference from a face-to-face meeting in the beautiful country of Portugal, which obviously our CEO, Dr. Liz Madigan, our president-elect, Dr. Kin Dion, and myself and other members of Sigma were very much looking forward to coming in person. However, as you all know, we've been fighting the war on COVID, but to all those individuals who have put out so much time, energy, we really thank you to make this happen despite the global pandemic. So thank you very much for that. And again, thank you, Professor Lumba, for the invitation and for your work as chapter president, for leading the chapter and all the wonderful things that you do, giving of your time, talents to move Sigma in a forward direction. So for today, I'm going to talk about not infusing joy, which is much what I'm known for these days, is going around and talking to many Sigma chapters about the organizational call to action, which is infusing joy. Today we're going to talk about influencing global health, reflections on the past and plans for the future. Can you see the slides? Mary Louise, can you see those?
Yes, perfectly.
Oh, okay, great. So the agenda for today is that we are going to talk about reflections on the past and spend most of the time talking about plans for the future. And then I hope to have time, I will make time for us to have comments, questions through the chat or however we want to do that. Now, that picture there I took in Geneva, and I thought it, by the lake, and I thought it represented quite well thinking about past and future. This individual clearly is struggling and thinking about his or her past, but in looking back, you can see the young people who have backpacks and are reading and studying for their college and learning. So through the window of this person's thorax is the future. So I thought this particular picture represented well our thinking around reflections on the past, what this person is doing, but also looking back to the future, if you will, in thinking about where we're going to go and how our past influences and gets us to think about how we can change the paradigm and move to perhaps a new paradigm of nursing, health, and wellness in the populations that we serve. In thinking about the past, we all know that we are shaped by the experiences that we have been involved in, by our families, by our loved ones, and in a professional way, we're shaped by people who have provided us with opportunities and mentoring. So I would be remiss if I didn't call out to the past presidents of Sigma, as we're talking about reflections on the past, an immediate past president, Dr. Tigges, and past presidents Kathy Catrabone and Hester Klopper were very important to me in helping me shape my thinking around leadership, running a large organization like Sigma, being a chair of a board of directors, and working with you all to the most effective way that I can. So as we think about the past, we often need to step back and think about who has shaped us and what that looked like and where we want to go. What is our passion and vision for us in the future? And think about how we were shaped and how can we move toward that direction. Obviously, the first thing that comes to mind when we're thinking about the past and the present, for that matter, is COVID. COVID has driven our lives, has caused us to reflect and work hard at thinking about safety, thinking about working together as teams, thinking about how can we use resources effectively, and the whole ethics of healthcare. So right now, as we think about the past, the first thing on our mind is how this pandemic has caused us to change the way that we're conducting business. For example, this is now a virtual conference. However, COVID is also in our future because one, the pandemic is still raging, and we see the peaks and valleys. In the United States, we have gone over 100,000 lives lost. And so before we continue on this presentation, I'd like for us to take a moment and reflect on the healthcare workers, the healthcare professionals, the nurses, all who have been working tirelessly, selflessly in support of the populations, the countries that they serve, and to those that have died, not only the patients, but the healthcare workers. So let's take a moment of silence to reflect on them and to thank them for that. Thank you for that. Other areas that in the past that we need to consider as we think about our future. Certainly, the Sustainable Development Goals and ICN's strategic priorities. they are something to really reflect on and to think about how are we moving forward, particularly as we know in nursing and in healthcare, about the importance, the overwhelming importance of physical and also the concept of social, oh, I'm blanking on the word. I just lost it. Sorry about that. It'll come to me. But how we all come together with our physical and social barriers that allow us to provide health care in the way that it needs to be provided. All the contextual factors that surround the patient and the community that interfere with patients and communities to become and to derive to the most, to the greatest health and welfare that they can become. Nursing now, the concept of nursing now, and how we partnered with members of parliament to strengthen our message and to develop nursing now, to strengthen the vision of what nursing could like in the future. That is something in our past and in our present that will allow us to move forward and think about how we can capitalize on nursing now. Okay, the word just came to me now. It's physical and social determinants of health. All of that, if I go back, all the determinants of health that we know impact and influence health and wellness, and how those incorporate both in the Sustainable Development Goals and the ICN strategic priorities. In the past, we recently have published the State of the World's Nursing 2020 and the concept of workforce and what that workforce could look like and should look like to develop the strategic models of care that are going to provide for the many, many challenges, which I'll talk about in our future. But knowing where we stand and what our workforce looks like is so critical in providing us with the data and the evidence to be able to build sustainable models of care that will drive the future of what nursing will look like and should look like, integrated into the whole concept of healthcare delivery. As you know, Sigma in the past met with each of the global regions and had both qualitative and quantitative research to get at what the gaps are for the vision and future of nursing. And we published the Gaffon Report. This also looked at what are some of the strategies that nurses need to have in terms of their capabilities to deliver the kind of care that is necessary in the 21st century and beyond. So this report provides us with evidence, just like those other reports have, to bring us to where we are now and to think about how we can best move towards the future. Under the direction of immediate past President Dr. Beth Tigas, Sigma came up with a new mission and vision, and our vision is to have connected, empowered nurse leaders transforming global healthcare. It's a very powerful vision, something we all should really be striving for, to get at how we as nurse leaders can transform and meet our vision of what healthcare delivery should and could look like in the respective country and community that you are either teaching in or practicing in or conducting research in. Also, we have our organizational call to action, which is linking the concept of joy and how can we build a culture of joy in the environments that we work in, but also a culture of joy within ourselves by having awareness, balance and purpose, and co-creation with other interprofessional groups so that we can put together collectively as a group of healthcare professionals an environment where the workforce feels comfortable coming to work and can experience joy. For many purposes, joy is an important element of our development personally, our development at a systems level, and for us to have creativity and move away from complacency, boredom, and burnout to an environment of where we need to solve these very challenging problems in healthcare that we are facing. So that's a broad overview of the past. And I'd like to spend a little bit more time thinking about what our plans for the future are. What is on the horizon? This is a picture I took from Alaska. If you've never been to Alaska, it has incredible skies and an incredible environment to go to really feel nature. One thing that I've learned through COVID and through being involved with Sigma is, without question, moving forward as a collective group, we really have come to realize that we are all connected. We are all connected. And whether you're in Grand Central Terminal in New York City, which happens to be my hometown, or in Taipei, Taiwan, in a marketplace, regardless of where we are all connected, both from a health perspective, but from a well-being perspective. What one country does and what one group of individuals do affects all of us. So we as nurses must remain connected. And that is one of the advantages of having meetings like this, but also moving to the future, strengthening our organizations both at the corporate level, but at the chapter level, to help us to stay connected, to look at ways to improve our connections, and look at ways to solve the connectivity gaps so that we all and each of us have a voice, and that voice is heard by all of us, to engage in the conversation, to minimize biases and prejudices. Everyone needs to have a stake and a voice at the table. There's a favorite quote that I have about having a voice and being connected. It's from a US politician who, her name is Shirley Chisholm. She's from New York. She was a congresswoman from New York. And she was the first American who was from African descent, the first female American of African descent to run for president of the United States. I admire her greatly. And what she said, if you're not invited to the table, you should bring a folding chair and step up to the table. So what she's saying is, we need to stay connected and we need to be prepared at the table to be able to have those linkages and those connections in the future. Even where there are no openings, we need to bring our folding chair, be prepared, and go to that and be ready to represent nursing in the way that it needs to be represented, because we represent over 50% of the workforce. My vision and what I'm thinking around the future, one of the critical elements of where we need to be thinking as nurses is that we need to be thinking about how we can strengthen the structure, the processes, the delivery of primary care. We are weak internationally about how we deliver primary care and providing the comprehensive 360 care that addresses health disparities and health inequities that are ever present across the world. And I have two bridges here. One is a bridge in a small town in southern Taiwan, in a very, very small town of less than 1,000 people, and they bridged across the water. And then a bridge from a very large urban town in Melbourne, Australia. So regardless of where we are, and whether we're in a small rural community area or a large urban area, we as nurses need to be thinking about how can we engage in improving primary care delivery, and where nurses can get involved and be leaders where in the delivery of primary care, whether it's at the RN level or at the advanced practice level or at the PhD or scientist level. All of us need to be engaged in thinking about how can we make primary care more accessible to the populations that we serve, and how can we minimize health inequities and reduce disparities, along with increasing our knowledge in primary care delivery. In the future, we're going to also have to think about how do we take the lead and engage and become partners with technology invaders, those large, robust corporations that are seeking to invade healthcare by providing all sorts of technology levers, telling us, oh, this is going to make your job easier. This is going to help you. How many of you have heard that from technology people? You have to have this, because without this, you're going to get behind and you're going to fall behind, and this is going to help you. Well, were any nurses involved in the development of that item or that innovation? No. So why do I think that that's going to help us? There hasn't been any nurses involved in the development of these technology invaders, whether it's an electronic health record, whether it's a mobile health device, whether it's some sort of communication where technology is supposed to help us to be better clinicians and better teachers and better researchers. We got to be in the game. So we have to think about both perhaps at the academic level where we're teaching and educating students, but certainly after and when we're in our formative and summative stages of our career, we need to think about how in the future we are going to be more involved with the technology invaders. Another area in the future that I think is critical, and this was mentioned today by Professor Walter, around the importance of integrating data and having quality data on our health populations that we serve, both at a high systems level, but also at an individual level, so we can help make informed systems level decisions, but also individual level decisions, sometimes referred to as more of a precision health perspective, and incorporating decision support into the workflow of what we do and how we teach. So this requires perhaps academics to rethink about curriculum and integrating more ways of thinking about large data and studying large data, and also how large data can inform individual and system level improvements. And there was a movie that you all may be familiar with about a baseball team called Moneyball. And this baseball team was an average team. They didn't do much in changing their players, but what they did do is they started collecting all sorts of statistics on the players they were opposing, on the players that they had, the field conditions, the temperature, all these different statistics, and they incorporated them in a model. And by doing that, they actually became champions by using the information that they had from statistics. You may have heard of Wayne Gretzky. He was a great US hockey player. And he always said, it's not about knowing where the puck is, it's about where the puck is going to go. And what he did, and the reason he was such a great hockey player, is because he studied hockey and studied how it's played, so that he would know in advance what happened when a puck was in the southwest corner, and where did it go from that, and how many times was a goal scored. And he kept statistics on this forever, and he used that to allow him to be very successful. We need to use those same concepts that our colleagues are using in large corporations to identify where their gaps and needs are in healthcare. So Data analytic tools in the future will help generate knowledge about prevention, treatment, and delivery models. It will help us to look at our evidence and how our evidence is being implemented. And is it making a significant change? Is it making a meaningful change in how we are implementing a new intervention? We need to also think about how we're applying evidence consistently and systematically. This is one of the huge challenges in healthcare, is that we want to minimize variation, because in minimizing variation, we minimize noise, which allows us to study and see if change is being affected. But we also know that we want to innovate. We want to change and we want to adapt and we want to do things real time to help make our practices and whatever we're doing better. So without the data, it becomes very difficult to see what the noise is around studying improvements. It's a very challenging thing to look at minimizing variation in how we do things, but also stimulating innovation. We have to figure that out because healthcare is a dynamic, ever-changing process. The concept of decision support and integrating clinical decision support in what we do, I think is important in the future. For example, when I started as a nurse practitioner in the late 70s, when I was doing Well Baby Clinic and checking babies and providing preventative health care, there were only 3 immunizations. There was diphtheria, pertussis, and tetanus. There was oral polio, and yes, I gave oral polio. And there was an MMR vaccine, a measles, mumps, and rubella vaccine. This is in my lifetime. Do you know how many vaccines there are now? There's more than 2 hands worth. And when I started practicing, there was less than 1 hand's worth. So in order for us to keep up with what's going on and for us to be able to have evidence around all the other areas of healthcare, we need help with clinical decision support. Huge challenge. Healthcare is so complex and there's so many inputs, and we need help to allow us to continuously stay on top of the evidence and provide care that is evidence-based. We know that mobile health is also an important component in the future. The concept of wearing devices, the concept of data coming from electrocardiograms from you wearing on your wrist, from activity levels, from dietary levels, sleep levels, all of these inputs, both from behavioral data and physiologic data that is being produced by all these devices. And in the future, nursing needs to be at the forefront in thinking about, okay, how is this data going to help us and not confuse us? Too much data can be very disruptive. Unorganized, cluttered data, very disruptive. How do we take this data and organize it and get it in some meaningful way to help us to use this data for us to be more effective and efficient in providing healthcare to not only the individuals, but to populations that we serve. We know that the climate, the environment is going to have a huge impact on health and well-being in the future. How do we get involved as nurses, both at the science level, but also at the political level in influencing climate change and greenhouse gases? We need to be involved with this. Our future, it depends on this to happen. That picture there is from the great city of Dublin. I took that when I was there, and I thought that gave us a perspective of climate. You can see how beautiful the clouds are and how we see our world. We don't want to lose that beautiful picture, that beautiful sunset, by allowing us to destroy our atmosphere. So it's so critical for us to be involved and to be engaged in the climate change. Another area that I believe is really important for us to be involved is nurses not only generate knowledge, but to implement, and the whole concept of implementation science. And the great French researcher Louis Pasteur said, "To him who devotes his life to science, nothing can give more happiness than increasing the number of just increasing the number of discoveries, but his cup of joy is full when the results of his studies immediately find practical implications. So in the future, we need to continue to have robust programs that allow nurses to translate evidence and bring evidence to health systems and to populations in a rapid fashion. And this is going to require the use of technology and the use of rethinking about how we deliver care. A model for this by Mitchell and Chambers helps to put it into perspective I like models just to give us a perspective, but I'm a very practical person. The model helps us to conceptualize, but really what does that mean? And when we conduct health services research, looking at ways to improve the healthcare that we deliver, to integrate disparities and health equities in care, and how can we, as a PhD level science community, look at health services research. Moving down a step, we have master's level nurses that can engage in dissemination research and implementation research, taking the evidence and the knowledge that is available and looking at ways to translate that, and then RNs who are looking at quality improvement. So how do we as a nursing community get the mindset of safety and quality from the RN? What is the RN, and what are the knowledge, skills, and abilities of the RN to do quality improvement? What are the knowledge, skills, and abilities of a master's level nurse to do implementation research and dissemination? And what are the skills of the PhD nurse to do health services research in the future? And I have an idea for that, but this is my idea. When you look at research, and this is a model that, oops, let me go back here, that looks at a healthcare as a health system that's a learning health system with continuous learning. And in order to engage those populations and those patients, we have to adopt exogenous knowledge that is coming from health research and studies and science that is outside of your health system. It's outside of the area where you're practicing from. Then you must also generate endogenous knowledge. This is evidence and knowledge around the contextual factors of the population that you're serving. For example, if we're in Coimbra, if we're in Portugal, and in that city, there's a health system, there's a hospital there. And that hospital has 100,000 patients that are using that hospital and that are empaneled to that hospital. The organization will need to generate data that's coming from the population that they're serving, as well as generate and integrate data from knowledge that's coming from studies that are outside of that population. Bring that knowledge together and then apply it and decide which. And this is going to be changing the way that I think that PhDs currently work. Currently, you have this academic health center, and you have PhDs that are working there as professors. I think in the future, what we need to do is have these professors and these individuals that are typically at academic health centers be part of the healthcare delivery system, so that we have PhDs that are integrating both academic and clinical realm together to help health systems make important evidence-based decisions that are going to strengthen how care is delivered in the future. So it wasn't all inclusive of individuals. What I talked about, it wasn't all inclusive. So I provided some other areas in thinking about where the future is and where the future may go, and where I think nursing is going to be a key proponent, a key stakeholder in that population. And I'll just highlight a few of these. Certainly the concept of aging and aging in place, and how are we going to care for patients that are living longer with more chronic disease and that are requiring more utilization of the healthcare system. How do we influence and integrate that? I talked about primary care, and for me, primary care is moving away from this concept that primary care is a place of walls. It's a building. It's a place where patients go to. That's a That's not really where I believe primary care should be. Primary care should be more integrated in the community. It's pushing out. It's not just pulling in, just not pulling patients to it. It's pushing out and being involved and engaged with communities and knocking down those walls. And that's really the prime place for the RN. The RN that's doing health education and surveillance and prevention in the community, not necessarily in the building of the primary care. We have to think about robotics and where that's going. We really need to think about in the future how we can do a better job of integrating healthcare ethics into how we deliver care. We saw that with COVID. We've had to make some individuals have had to make some really serious decisions about resources. And what do we do in the event that we don't have enough ventilators or we don't have enough medication, that we have resource constraints, but yet how do we go about making those kinds of choices? We have to really think about the whole concept of economic recovery in the future. Right now, we're fixed on social distancing, lockdown, standard public health measures, but our economy and each world, sovereign country is economically struggling right now. So how does that impact health, and how does health impact the workforce? We know that health has a huge influence on the global workforce, which has a huge impact on productivity of the nation and the gross domestic product. So how do we integrate that into teaching students and what we do as nurses? So I have a couple of other things on the right side. I think we do need to think about COVID, PTSD, which was mentioned, and how we're going to plan for PTSD after this is all over. We also need to think about how we're going to become more politically engaged and how we are going to, what was brought up earlier, there's more nurses in the news, there's more nurses being in the media, but how do we in the future capitalize on nurses in the media to facilitate the kind of changes that we think should happen, both by regulation and statutes? Sigma has a repository which is available for all of you to, from a Sigma perspective, how can we help in the future? We have a repository where all of these presentations are going to. That will continue to be available to help to disseminate information, and it's open sourced. We also will continue to provide research grants that will allow for investigators to do research, to think about future and how we can make these kind of changes in the future. So in closing, I have a couple of more slides. One is we need to think about leadership and how we can be better leaders, and we need to take risks. We also need to think about how we can be more creative, and creativity stems off of having a sense of energy and joy, which allows for you to be creative. Robin Williams said, you're only given one little spark of madness. You mustn't lose it. And as you can tell, I still have my madness in me. I have not lost my madness yet. Follow your passion. Always think about where you're going and follow your passion in the future, and that will be your North Star. When is the time? The time is now. Now is cool. I took this picture in Milano. It was in Milan. Dr. Liz Madigan and I were in Milan for a meeting, and it was right before the COVID hit, and the Duomo was packed. People were all over Milan, and I saw this person here. Now is cool. So I thought this represented, when should we get started? Now. Now is the time. Now is cool for us to look to our future. So thank you all. Together we are Sigma. Together as a collective group of nurses, we can make it happen. So thank you all for the time, and I look forward to questions. I think I have a few minutes left.
Thank you very much, Rick. I don't know, but there's been quite a storm on the chat. So I just want to mention, obviously, Professor John Dewing, Caroline Dickinson, Llewellyn Morgan, Samdi P00, Mary Gaffey, Joy Morell, Anita Caitlin, Ellen Buckner, all have been posting on the chat, mostly comments building up. So maybe I'll open it up now to others. Have we questions that we would like Rick to maybe make a stab at answering? Now's your time. Hello, anybody willing to make the first, because there has been literally quite a discussion on the chat. So unless I could start reading out some of the chats.
Louise, Marie-Louise, I can ask my question.
Please, thank you, Jan.
Right. We posted on the some of the work that we do is focused on human flourishing, and I wondered how you saw the connection between joy and flourishing.
Well, obviously, the way from my perspective, thank you for that question. My perspective that joy is a natural and important ingredient to drive creativity and to drive your ability to move from a complacent individual where you go in and do your work every day and you do it perhaps well enough, but it's not going to get you to the future. So flourishing is about getting you to the future. It's about stimulating and thinking about how you can strengthen what you're doing, but also improve what needs to come. So I think there is a link, obviously, between flourishing and because in order to flourish, you need to have creativity. You need to have innovation. You need to have a sense of how can I do this better and to really enjoy. At the end of the day, it's my personal opinion that in order to get to be joyful, it means that during that day, you've done something that you're proud of, that you had responsibility for in making that decision. And then you can go home and say, you know what? If I wasn't there that day, that decision wouldn't have been made and that wouldn't have happened. So I made a difference. So when you're flourishing, I think along the same way, you are driving towards your passion and to what you believe is important to you, because each individual has a specific purpose. It's my belief that every person is unique and everyone has a specific purpose. And it's that purpose which I think is linked to flourishing. Once you know your purpose, once you know where your North Star is, you can then move forward and flourish in that region and feel good about what you do, being linked to joy. So I think it's a necessary ingredient for success and creativity. If you look at all the great scientists and you talk to them, many of them would say, you know what, I would have done that for free. I would have discovered, pasteurization, Louis Pasteur. I would have discovered how to pasteurize wine and milk for free. Probably because he probably couldn't decide which was more important, pasteurizing wine or pasteurizing milk. But, and we can have that argument someday over a glass of wine, which was more important. But I would say that he was so driven by his concept of doing pasteurization and understanding the genome and discovering, not the genome, the germ theory, and understanding germs, that's flourishing, right? That's having joy in your heart and really driven by a passion for what you do. So I think they're inextricably linked together.
Okay, thank you. Do we have any more questions? Maybe just one?
Yes, this is Dr. Albuquerque.
Yes.
Oh, somebody.
No, fine, please.
Jen.
No, you can.
Oh. Okay, this is Dr. Albuquerque. I just want to thank the president for bringing in this future vision of joy. It's so important. We can become researchers and publish and do all these great things. And such a great example is like, I would have done this free. I just want to thank you because joy is something that we need to move it forward in nursing. Thank you.
Well, thank you for that. I think in moving joy forward, we can't assume that it's just going to happen naturally.
Right.
It's not a passive process. That I put it out there for everyone to think about, knowing that it is an active process. We have to work on it. We have to think about and incubate how we can promote joy. You as a leader in nursing need to think about how the environment that you have responsibility for, that you can change, you know, as Gandhi said, be the change that you want to be in the world. So how can you be that change and create the environment that joy can flourish? Now, I understand that you can't do it alone. That's the co-creation part. But as leaders, we have to take responsibility. For example, with the PPE, personal protective equipment, as you know, without question, I am so humbled to be a nurse and so in awe of nurses who are providing care, as we heard from Professor Walter earlier, and you know, the number of nurses and other healthcare professionals that acquired COVID because they didn't have a proper PPE. That's heroic. However, we as nurse leaders should think about not putting nurses in that position. We're all responsible collectively as leaders in nursing for nurses to be in a position where they are compromising on their safety. And I'm putting myself in that mix. I feel like I am also responsible for allowing, knowing that we knew without question that another pandemic would happen. And another one's going to happen after COVID at some point in the future. Yet we were unprepared. So we as leaders in nursing have to assume some responsibility, just like we need to assume some responsibility for joy. We can't just assume that these things are going to happen naturally. That's what leadership is. That's what, you know, that's why we're having this meeting, to make us all aware and to have us think about what's in our, you know, what's in the dynamic of the future. So we don't let us not to be in a position, so we're in a position of the future that if a pandemic hits, we have the right amount of personal protective equipment so that nurses do not have to go in harm's way unprotected.
Okay, I'm just looking at the clock here, and I'm seeing we're up at quarter to 7 here in the Netherlands, obviously 5:45 GMT. Do we have any other questions? Otherwise, I would suggest we can follow this on our conference app or on the social media European region, or if that's okay.
So I'd like to thank you all. It was a pleasure being here. You can reach me at any time through my email, my Sigma email. I am just so thrilled to be here and to be with you, and so thankful and grateful to be able to be amongst so many nurses who are doing so many wonderful things. I hope some of that rubs off on me to make me a better person. So that's what this is all about. So thanks again, Professor Lumba, for the invitation. And I look forward to coming to Portugal in person, put my feet on the ground